And if I can ask, how many people are doing clinically oriented work? Can you raise your hand? Okay. And how many of folks are doing primarily science and research at the lab? Okay, all right, good number. So hopefully we will have information, for all of you to be able to take with you today. And again, I think the most important thing is for you to, it's hard to remember everything, of course, that you're going to be hearing, but so that you kind of get a bit of a sense of, of what's available to you. So again, for those of you that weren't here at the beginning, I'm Maria Oliva-Hemker, or Maria Oliva, Vice Dean for Faculty. So I'm actually a pediatric gastroenterologist, and not, you heard here, you got a sense that maybe the folks here have been around for a long time. I've been around for a while too, but don't let that scare you. But I have also been here since medical school. So my training was in pediatrics and in pediatric GI, and I'm the division director for pediatric gastroenterology, hepatology, and nutrition, when my focus is inflammatory bowel disease. So I'm a clinical researcher and have certainly benefited from being here at Hopkins, from the mentoring, from the guidance, from the collaboration that you will see that we have here. And I stepped into this position of Vice Dean for Faculty in 2021, so relatively kind of newer compared to other folks that have been in leadership positions for longer. So I'm going to talk to you about our Office of Faculty, because this is the School of Medicine. This is your home base in the School of Medicine, and it's important for you to be aware of, the offerings that we have. And I want to start just by showing you this slide, right? Although we're great, we're actually not the only school at Johns Hopkins University, and these are the other schools and divisions that form Johns Hopkins University. Our president, Ron Daniels, who is the president of JHU, and therefore he oversees our CEO and dean, is very fond of saying that we are one university. And it's important for you to be aware of these divisions because, to a certain extent, you may have collaborators in some of these other divisions. I have a collaborator at the Whiting School of Engineering. He's my husband, actually, so we collaborate at home. But so some of you may have partners or spouses that are in these other divisions, but certainly there are a number of us in the School of Medicine that have research collaborations with some of these other schools. So you should be aware of these. Hopefully everybody knows that the Bloomberg School of Public Health is just across the street from the hospital, so on the East Baltimore campus, as is the School of Nursing, which is also here in East Baltimore. So it's important for you to see this at least once, right? What is the mission of Johns Hopkins? And key words here, it's to improve the health of the community and the world. It's important to see that we have the words diverse and inclusive, because that is the type of institution that we have. That's in our mission statement, and that we are here to educate, to conduct biomedical research, and to provide patient-centered medicine. So our tripartite mission, why there's a triangle, why it's a triangle in the Hopkins logo, is for education, for research, and for clinical medicine, that we want to, and we are excelling in all three aspects. So when you hear of that tripartite mission, that is what we're referring to. This is the School of Medicine. It has 32 departments, and so hopefully everybody can find their departments here. We have 21 clinical departments. They're in black, and then we have 11 what we call the basic science departments. They are there in blue. Hopefully everybody can find themselves in here, and if you can't, come and see me later. But this is, it's a vast organization. You heard we have to keep saying this, 45,000 people are within the umbrella of Johns Hopkins Medicine. So here are the 32 departments. And here's a little bit about the demographics of our faculty. That is, all of you. So there are about 5,400 faculty in the School of Medicine, of which more than 3,400 are full-time. The demographics show us that about 54% of us here, of you, identify as men, about 45% women. The bulk of our society, of our faculty, are in the clinical departments, 93% of them, with 7% in the basic sciences. And we are a very international community. About a quarter of our faculty were born or came from countries outside the United States, with China, India, and Canada being the top three. And as you see there, when we just look broadly at race and ethnicity, about 60%, or a little bit over 60% of our faculty identify as white, a little bit over 20% as Asian, and Black, African American, Hispanic, it's about 5% each. So our faculty does not necessarily at this point represent the community of patients and the population of individuals in the United States. We are working hard in order to have us reflect back our learners and the individuals that we care for and for which we are doing research. So you've already met Dr. DeWeese, and you met Landon King. They had mentioned the other vice deans in the School of Medicine. I'm showing them here. They are my colleagues, and we are all here. Actually, we're here to work for you. And so you'll have access, and we'll show you these names. Again, you can reach all of us via email. It's not uncommon for faculty to reach out to us directly. So if you have any issues, again, often they can be taken care of at the division or the department level, but you can just email one of us. You can certainly just email me if you have any questions about faculty, and I'll figure out how to best get your question answered. So this is the broad areas that the Office of Faculty oversees. I've listed them there kind of in major categories. We oversee appointments and promotion, how you are academically promoted. We have multiple career development opportunities and leadership development teachings and opportunities for you to learn about how to become a leader. All of your information, your data, what you're all about, everything, all of that is housed within kind of the Office of Faculty Group. So anytime that you need specific data about yourself or that your department does, they typically come to our office. We oversee anything that has to do with faculty policies and procedures. So if something happens on a policy level that's going to impact all of you, it will typically be coming out of our office, but with broad input from all of you and from many of the various faculty groups that we have. And speaking of faculty groups, faculty governance, which includes the Faculty Senate, we are kind of the umbrella home for that group. For issues of gender equity, for issues that impact women in science and medicine, we have a home in our Office of Faculty. And for all issues that deal with professionalism and potential misconduct. Now, I know all of you are just like amazing people, but you're in a city of 45,000 individuals. There's more than 5,000 faculty. This is a very stressful line of work, research and clinical medicine. And so there are bound to be some issues that come up. If they have to do with a faculty member, they come to us and through our office, as opposed to it being an institution where it's kind of an HR thing. And that's a difference that you should be aware of. And then we interact and liaison with the Office of Wellbeing. You're going to be hearing about that office in a little bit, as well as the Office of Diversity, Inclusion, and Health Equity. And just to show you, these are the deans in the Office of Faculty. You are going to be hearing from a number of these colleagues today, so you're going to get to know them really well. Our Associate Dean for Faculty Development, some of you may have already have heard about her, Kim Skorupski, just recently left to take a vice provost position down at UT Southwestern. So that position is open at the time, and we hope to start looking for a replacement in the near future. But you're going to be meeting and hearing from these folks throughout the morning. All right, I want to show you 3 books. I put them now in quotes because they're going more into the virtual digital world, but these are important for you to know about, very important. Most important of the books, well, yeah, you should know, is the Gold Book. We call it the Gold Book because the name is way too long to remember. You see there, policies and guidelines covering the appointments and promotions and professional activities of the full-time faculty. So we refer to this as the Gold Book, and this is the framework for good faith interactions between the faculty and the School of Medicine leadership. In this Gold Book, it has the policies for your appointments, your reappointments, your contracts, your criteria for promotion. So you should be aware about this book because whenever we have any major issues, anything that we're like, how do we solve this problem, we often turn to the Gold Book. All right, so all of you can easily Google it. You can get to it from our Office of Faculty website, but you need to know about this. If you, again, what does it take to be promoted? What is my appointment like? Can I take leave? All of those issues are in the Gold Book, all right? And then there is the Silver Book, and this is the professional guidance for promotion. So think about this this is like your recipe book for how to get promoted. And it contains information about the standards for appointment or promotion to assistant, associate, or full professor. It gives examples of academic accomplishments or contributions that support each rank. And if you see here, I'm showing you the cover of the 5th edition, which was in 2016. This Silver Book actually has been updated by our office and is currently in the process of making its way to be reviewed by various faculty groups as well as by the dean. And so we hope that we will be able to have the 2024 version of the Silver Book out soon. We're going to be telling everybody about it, so you will be hearing about it. And it will be, for the first time, a web-based book so that you can more easily find the information that you need. Although for those of you that need to have paper in your hand, you're going to be able to download a PDF as well. But this is going to be updated it's already updated, but it should be up, my hope is, certainly by the end of this calendar year. And so it will provide you with new information in terms of promotions. And then if any of you have part-time appointments, we have the Blue Book, and these are the policies and guidelines that govern those appointments and promotions for faculty that are on the part-time staff. And as you heard, we've got about 1,600 part-time faculty. So the Gold Book, the Silver Book, the Blue Book, those are important policies for you to know. All right, you're going to be hearing a little bit about this later on as well. Pathways to promotion. We have 2 tracks at Hopkins. We used to only have 1, but in 2020 we have 2, and it's still probably less than many institutions that you may have come from. We have the scholarship and the clinical excellence tracks. The scholarship track is based That's the original track, the one that's been here since the late 1800s. It's based on the dissemination of new knowledge and the achievement of either national or international recognition at the levels of associate professor and professor. The clinical excellence track began in 2020, big deal at Hopkins to do something like this. This is a track that's for those of you that are performing primarily clinically related work for probably at least 60% or more of your time. Promotion on this track has to do with sustained clinical excellence, but you still need to be involved in discovery and education. And for associate, it's based on broad regional recognition. For professor, it's based on broad national recognition. Here's the important thing about these tracks, which is very different from other institutions. Whether you go the clinical excellence track for promotion or the scholarship track, at the end of the day, when you get to be professor, both of these tracks give you what other places may call tenure. We don't call it tenure here. It's contract to retirement, but it's equivalent. And that's very different from other institutions where clinical tracks never enable an individual to achieve contracts to retirement or tenure. And you're going to hear a little bit more about that later. All right. The professional expectations of the faculty. It's important for you all to be aware of these things because, again, you are all great people, but we understand, there are times where things can get a little bit rough, and it's important that, we keep our conduct as professional as possible, and I've got some policies here that are very important for you to be aware of. So again, the Gold Book has key policies on how faculty are expected to professionally conduct research, clinical care, and deal with educational activities. There's a professional code of conduct that sets forth the expectations for all of us, and I'm going to show you that, I think, in the next slide. There is a policy on the conduct of teacher-learner relationships and learner mistreatment, and we refer to that as the learner treatment policies. There are thousands of learners that you're going to become exposed to, and it's very, very important for us to realize that we need to be role modeling appropriate behavior for these individuals. So there's a policy for that. There's also a relationship policy that you should be aware of, and it has to do with the development of relationships, like real relationships, like what am I going to say? Like romantic relationships. Thank you. I was going to use the word sexual, and that wasn't going to sound right. Oh my God. So those kind of relationships. It's not that you can't have those relationships unless it's with an undergraduate student. That's a no-no. No, okay? But it's known that, those relationships may occur. There's a policy about that, especially if there's a hierarchical difference or if you are in the same division or department. It's not that you can't have that relationship, but it needs to be disclosed, okay? All right. This is the School of Medicine Professional Code of Conduct. There are 8 bullets here, and it specifically says faculty must refrain from, behavior that is disrespectful and interferes with the work or the learning environment. Refrain from unwanted physical contact or threats of contact, sexual harassment or harassment based on any protected class or harassment in general. Faculty must refrain from maintaining supervisory roles over faculty members or partners. We should not lose our civility, and that includes no throwing things across the room, nothing like that. No displays of horrendous temper, nothing like that. We should refrain from any type of discrimination. We should not be asking students to walk our dog or, take our dry cleaning in. Please, that's a no-no. And we should not be misappropriating property or any resources and using them for personal business. This is all written down. It's in the Code of Conduct. I know that you all are not going to need it, but you should be aware that this is on paper. And we do take it seriously because we want to maintain the best culture possible here. If you do have any issues, if you do have any concerns, there is a hotline in which you can put in concerns. It can be anonymous or your name can go on it. And it's called Speak to Us. You can just Google Speak to Us, Johns Hopkins. It's 1-844-SPEAK to Us. You can take a screenshot of that. Hopefully you won't need it, but you should be aware that that exists. And that's a hotline for everybody in the university. And if there are specific issues about harassment for protected class or sexual misconduct, it's our JHU Office of Institutional Equity that actually deals with that. Again, you can either call them. If you are calling on behalf of somebody, you can also do that. Again, it could be anonymous, or you can give your name. Now, let me switch here to, for those of you that are, I think most of you should be around your first faculty year. We have one of our advisory groups, the Faculty Affairs and Development Board, which consists of all the vice chairs that are in your department that deal with faculty, came together and made recommendations of these being the 3 phases of onboarding in your first faculty year, and you should see whether you're kind of doing these things broadly. So in phase 1, it's really all about making connections, meeting colleagues, meeting the leaders, identifying a peer mentor, like the person you can do the phone a friend to, attending your department events, School of Medicine events, just so that you get to know your surroundings, right? By now, does everybody know where the bathrooms are, right? And what are the various shortcuts? I was a little bit concerned that you all might not find this place because of all of the construction. There are a number of ways to get here, including underground tunnels. And if you don't know that, maybe a friend will show you how to get here. I've been here now so long that I know where every tunnel is, okay? Phase 2, you're going to start to align your professional goals and expectations. So what does that mean? Clarify your roles, your responsibilities. What are your expectations? This is key, folks, now more than ever. Understand where your compensation is coming from. If you have not had your division director, for example, sit down with you, and this definitely needs to be happening in the next month or 2, if it hasn't already. You heard Dr. DeWeese, Dean DeWeese, say, there's news coming. I'm not going to say yet what it is, but it has to do with faculty compensation. You need to know what are all the buckets that are going in to make up your salary and what your responsibility is for those buckets. Happy to answer questions later. And then continue your dialogue with either your department, depending on the size of the department, either your department director or your division director. And then phase 3 of that first year, establish your professional development plan. What do you plan to do over the next 2 to 3 years? Do I have the right mentors, the right coaches to help me, the right sponsors, at least to get me off the ground? Learn how to secure resources, how you can get help, and understand, even in that first year, how you get promoted. That is something that's important to you, and we're going to assume that's important to all of you at this point. Understand so that 2, 3, 4 years don't go by and you're like, what should I have done, okay? Now, I'm going to end up here just showing you how we communicate with you, or how we try to get the word out. We have an Office of Faculty monthly newsletter. It's called Faculty in Focus, and it has School of Medicine information for all of you. We also use the opportunity to congratulate and highlight everybody who has been promoted in the kind of the previous time period. So keep an eye out for this. Don't delete it. At least take a look at it quickly and see if it provides you any benefit. We also have some career development programs and resources that go out on monthly emails. Some are webinars and career development sessions. Another email has to do specifically with faculty who have interests in medical, scientific education. And there's a broad list of activities. For example, like this one talks about the Early Career Leadership Series. And it's webinars that you can sign up for to get some additional information. So please be aware of these. We have an Office of Faculty YouTube channel, and the topics from this orientation are going to be on that channel. We have other videos. For example, last year, out of our Women's Professional Advancement Council and the Office of Faculty, we hosted a fireside chat in the evening with a Pulitzer Prize-winning author and a scientist from the book The Exceptions, which was the story of the women who were able to kind of change the culture at MIT when they made known kind of the amount of sexual harassment that was happening. And it was actually a great event. So things like that you can find on our Office of Faculty YouTube channel. And then we just redid the Office of Faculty web page, homepage this year, and we will be highlighting this more this academic year. You can just, Google Office of Faculty Hopkins, and this should pop up. And there are a number of icons that you can see here where if you need any information, you can just click on it, and it should take you to the appropriate pages. We are working on it because we realize there are thousands of pages attached to our web page, and we wanted to make the entry portal more welcoming for all of you, but this is literally something that just happened, and we're working on things. So again, if there's something that doesn't make sense, just let us know. And then I want to make you aware that this is very new news, but in early 2025, we are going to have our next faculty satisfaction survey. These surveys have been ongoing since 2013, and it is a really important source of data that's used by School of Medicine leadership to hear what's going on from all of you. And because our faculty do know that it's such an important survey, we've achieved greater than 70% response rates, which is a highly dramatic response rate for surveys. But you can see that data from past surveys have resulted in things like the creation of the Clinical Excellence Promotion Track, the development of the Academy for retired faculty. You guys are not there yet, but that was a major thing. It's led to increased transparency in the faculty compensation plans and in the promotion process, and an increased in faculty development resources for those that are in an early career. So I just want to let you know this is coming. You will not miss it because we will highlight it many times, and so will your department directors, but please fill it out when it does come. And so let me just finish here by saying that, again, we're here to support you. There's my email there, moliva@jhmi.edu, or if you have any general inquiries, it's vdfaculty, Vice Dean Faculty at jhmi.edu. Welcome again. Thank you for being here, and I hope to meet all of you individually.